I will now reconvene the Subcommittee on Federal Workforce, U.S. Postal Service, and Labor Policy, and welcome our next panel, our witness, Mr. Walton Francis, who is an author and a healthcare expert. Mr. Francis, it is customary for those that testify before the Oversight Committee and its subcommittees that they do be sworn in under oath. So if you wouldn't mind, stand, raise your right hand. Do you solemnly swear or affirm that the testimony you are about to give this committee will be the truth, the whole truth, and nothing but the truth?
I do.
Thank you. Let the record reflect that the witness answered in the affirmative. Please be seated. We do have your opening statement by way of a written testimony before us, but please, I'd like now to recognize you for 5 minutes for an opening statement.
Thank you, Mr. Chairman, members of the committee. I'm going to just try to summarize very briefly. First, the proposal before you is essentially a proposal to dismantle the Federal Employees Health Benefits Program. That program covers 8 million people. Probably half the plans in that program will be forced out effectively. All the people in all those plans will be forced to move to new plans. A lot of these people are elderly, don't want any change. They're going to be faced with massive change. And all that proposal is unnecessary, which I will explain in a second. So that's the issue before you. Let me just say first, I happen to agree strongly with virtually the entire postal plan that I heard described by the Postmaster General. And I cannot urge on you too strongly that the Congress it's incumbent on the Congress to fix the flawed legislation under which the Postal Service now works and give it a chance to solve its problems. This part of it, however, isn't part of the solution. It's part of the problem. Second general point, the FEHBP model, multiple plans competing for consumer business, is a widely adopted and copied model and has been the winning model in the Congress of the United States and with the last 2 or 3 administrations for very good reasons. And I won't go through the whole list. The Bro-Thomas proposal was to copy the FEHBP for Medicare. The Medicare Advantage program and the Part D programs were when enacted were explicitly modeled after the FEHBP with improvements, okay? But that was the model, and both have been hugely successful. The original Paul Ryan proposal, Ryan Rivlin Domenici, Ryan Wyden, which I think is maybe the best of that group. Just the budget resolution that the House passed a few days ago. That's the Medicare part of that is modeled on the FEHBP. The Obama administration's health reform, whichever side of that issue you're on, the state exchanges where multiple plans compete for people is modeled on the FEHBP. Now let's talk about the pre-funding issue. There's a reality here. The pre-funding is not going to be paid ever. $5.5 billion is toast. It may be carried on the books as a debt owed the U.S. government. It may be written away by legislation you pass. I don't know how it's going to be solved. The only thing I'm sure of it's not going to be paid. So now the question is, why are we going to destroy the FEHBP to create what amounts to a fig leaf for not paying the $5.5 billion? I just find that Kafkaesque. It's driven in part by the budget rules and that control you to some degree in how you account for things. But that's the reality. And the other part of that reality is the money in the trust fund, okay, actually every trust fund, the Social Security trust fund, but the pre-funding retirement thing, that trust fund is a paper fiction. It's an accounting exercise. Any money spent out of that fund will actually be spent by taxing the American public or borrowing money to be paid by our children some years hence through taxes. The money is taxed. It's not there. Remember the Clinton administration, all the lockbox talk about Social Security? That was essentially a debate over this same issue. I'll stop there, but merits of the proposal. I got to tell you that I have read one of the consultant reports that the Postal Service got, and I've read several of their own reports. They are full of errors, false assumptions, misstatements, and so on. I won't go through all the examples, but I have one simple one. They're talking about saving money on prescription drugs because they're going to operate a single plan that's going to enroll 2 million people. Well, the FEHBP has a single plan that enrolls 5 million people. It's called Blue Cross. Funny thing, how are they going to save more money covering 2 million people than we can save covering 5 million people? It's unreal, okay? It's made up. They have never recognized, but I've given you my testimony details on it's going to cost at least $500 million because the postal employees are subsidized by the GS and other non-postal employees who are much younger on average and healthier, and it's all one pool. So there's a $500 million plus subsidy every year going into the Postal Service. Okay, they pull out, they're going to have to spend an extra $500 million just to maintain existing benefits and premiums. They start a $500 million a year behind. The other point about I want to emphasize is a lot of what's going on here is shifting costs from FEHP to Medicare. That's not real savings. That's moving them from one pot to another. And when you get some real analysis from CBO or others, and I don't count the Postal Service Inspector General in this group, okay, you're gonna hear what I'm telling you. Postal Service, unlike most federal agencies, has a lot of flexibility right now under current law. One of the suggestions I made in my testimony, kind of buried near the end, is they could offer to pay its employees a bonus for signing up for Part B. I mean, just say we'll pay $100 if you sign up. Or they could say we'll pay you $100 if you switch from higher cost plans to lower cost plans. They have the ability to create employee incentives right now. They're not bound by the general schedule, pay schedule, and all the rest. Their record, I won't go through their record in the past, they have bargained with the unions quite properly. The unions have sought the best possible benefits for their members. That's their job. But one of the prices paid by that has been overpaying premiums relative to the non-postal side and relative to the private sector. The good news in all this is they are focused like a laser on the biggest single defect in the FEHPP, the interface with Medicare. And I cannot commend to you too much how important it is to address that issue. But not for the Postal Service alone, for the entire program. Okay? It's crazy the way it's done now. And it's going to get worse. People are going to bail out more and more from Medicare. I might add, this committee, I don't think, has the jurisdiction to solve this problem alone. For one reason, they're proposing mandatory enrollment in Medicare Parts A and B. Well, I'm going to tell you something. There are tens of thousands of 80-year-old widows, Postal Service widows, who do not have coverage for Medicare Part A due to having their work or their husband's work, and who opted out of Part B. The premium cost for that one of those widows to join Parts A and B right now under current law in the Social Security Act is over $8,000 a year. That's what it would cost to mandate that that widow leave the postal plan she's now in and sign up for A and B. There are several ways to reform this. Part of the question will be who is going to, how are the savings going to be shared between the Medicare program, the employing agencies, and the FHEP system, and the retirees themselves. A lot of options here, but the basic idea, I think, is to provide positive incentives to retirees to join. First place, Medicare Part A is automatic. You can't get, it is illegal to collect Social Security in this country if you're not in Medicare Part A at age 65. So this stuff about people aren't signing up for Part A or, all these taxes have been paid in. All the taxes paid in are Part A taxes. Anyone who is not age, in the 80s or 90s, in Postal Service retirees already is in Part A once they hit 65. So that's a false issue. And it's been misdescribed. Again, I'm sure it's not the Postmaster General's fault, but the people who write his speeches, the people who prepare these consulting documents aren't getting it right. Part B, where the premium for most is $1,200 a year, it's easy. The right model is the employer or the plan, directly or through the employer, subsidize people to incentivize them to join Part B, and you don't have to give them 100% complete wraparound benefits, which is what they now get if they have Part B, because that induces massive waste. And there are real savings to be made by reducing overutilization of medical care. Thank you very much.
Thank you, Mr. Francis. I appreciate your energy, especially your expertise in this area, and I'll now recognize myself for 5 minutes. I want to talk about pre-funding for a quick second because you touched on that. Are you suggesting then, because it is simply not true that everything's being set aside, that it's really an obligation to pay an IOU, if you will, in a trust fund, that we all just call it what it is and eliminate it entirely and tell the American taxpayers that they're going to be on the hook for the funding, the unfunded liabilities of health care and retirement benefits? Or how do you?
I don't know the best answer to that, Mr. Chairman. A couple of points. First, if we reform the Medicare interface, that alone will substantially reduce. I mean, that part of what you heard from the Postmaster General is correct. So the unfunded liability can be greatly reduced if you can get more federal retirees to enroll in Medicare Part B. So that's sort of point A. Point B, a lot of this may hinge on scoring rules and so on. I think the Congress enacted this pre-funding requirement about 4 or 5 years ago. So I understand it, the expectation that the Postal Service might go insolvent, so we better get these funds before it's too late. And then it's turned out that the pre-funding itself has been the single biggest cause of the Postal Service's budget hemorrhaging.
Which, of course, it isn't. I mean, there's systemic reforms that need to take place.
Right.
I mean, give them the $5 billion or the $5.8 billion, they're still showing over a $5 billion annual loss. Has nothing to do with pre-funding. But be that as it may, also on the Medicare issue, Mr. Donahoe mentioned that he's the second largest employer that contributes to Medicare, and therefore there should be some benefit for that contribution. How do you reconcile that?
Well, I don't. It just sounds like strange language to me. First, he's not the second largest. How about the civilian side of the federal government? I mean, don't they count for something? But viewed from a business perspective, I'm not going to argue with this point. But what he is doing and the employees are doing, and by the way, economists all believe that the entire burden of the Medicare Part A tax is paid by employees. It effectively comes out of wages, okay? The postal employees are paying into a Medicare Part A trust fund, and they're going to get free Medicare Part A when they retire. That's the deal. There's problems with that deal, but they're not Postal Service problems. There's nothing special about what the Postal Service is doing. That's the system for every employer in America.
Now, obviously, we're here because we wanted to talk about the proposal on the health care benefits, but that's just more of a symptom of the major problem. The major problem is that there is a problem within the Postal Service that requires reorganization and reformation. One of the issues that we have to address, of course, is their labor costs. Over 80% of their cost is labor. How do you recommend that we handle that?
This is a similar problem. No, actually, it's a common problem.
This is a $60 million question.
This is what Rhode Island faced and had to take really drastic action to reduce public employee pensions, okay, and health benefits. I don't know the right answer as to how, is the Postal Service going to, no cost of living increases and so on?
But you would agree we have to address the labor costs.
Oh, absolutely.
Because the revenue side of the equation continues to decline. And even if it stays static on the expense side, we're going to have further and further shortfalls.
Yes. And I have no sense of whether postal employees are overpaid or underpaid by any metric. Right. But clearly reducing labor costs is a vital thing for them to do. But I want to be clear, for employees, they're going to increase labor costs. Their proposal is not going to save money, it's going to cost money.
And let me throw out something there. In your written testimony, you talk about a health savings account and a contribution. So do you believe that maybe there's even a more innovative way to stay within FEHBP and just change the way we do it and have the Postal Service contribute less but more by ways of an HSA?
Yeah, absolutely. They could go ahead and give health savings accounts to employees who sign up for Part B. Okay, actually, that's another area we might have to change the law.
So in other words, we could reduce the cost because the premium would be reduced and yet increase the amount we put into an HSA and have a net decrease of what we're investing in health care.
Yes. That could be done tomorrow, assuming there's no legal impediment on the Ways and Means side. Don't know of any other legal impediment.
One last thing. When reading you indicate that the USPS finds itself in a predicament that is primarily the result of one flawed statute that enables Congress of the United States to micromanage what should be a business decision. Any suggestions in the next 30 seconds that you would offer how we could make that a more flexible statute so that there would be more flexibility to the Postal Service?
I think the proposals that were discussed that are in the bill that you discussed with the Postmaster General all sound to me perfectly reasonable. I think the flexibility to close processing centers and post offices is very important, but it's not probably as important as some of the other things discussed. I think he has a great plan, and I hope the Congress enacts all of it but this piece.
One last quick question. Have you had a chance to consult with the Postmaster General on any of his proposals?
Only a few seconds before and after his testimony, sir.
Thank you, Mr. Francis. Now I'll recognize the...
There are a lot of us in Congress in the same position.
No, it's all up to you. You want me to go to him? Yeah. Okay, I'll recognize the gentleman from Virginia, Mr. Connolly.
Thank you, Mr. Chairman, and thank you, Mr. Lynch, for your courtesy. I have to run to the steps of the Capitol, so I really appreciate it. I have a middle school group of 200 kids. I want to welcome Mr. Francis, who deservedly has the the reputation for being the walking expert on these matters, and I thank you, Walt, so much for being here today. If I understood your testimony, let me get this straight now. If we were to adopt whole and entire the Postmaster General's proposal with respect to health care here, it would actually cost the Postal Service $500 million, that transition, because they are now beneficiaries of being in a larger pool, and therefore they are subsidized.
Correct.
Would it be $500 million every year, or just one time hit?
Yeah, no, it would grow over time because
grow over time.
Yes, sir, because they have already have an aging workforce that's much more aged. The crucial point is a 50-year-old, on average, in this country, costs something like $8,000 a year in health care, and a 20-year-old costs something like $2,000 a year in health care. They're not going to be hiring any more 20-year-olds for at least a decade to come. The existing leave aside those retiring, the existing workforce is going to keep aging. They're going to be more expensive every year. The best thing they could do is stay in that FEHB pool and get, in effect, the cross-subsidy from the younger and healthier ones being hired.
So golly gosh darn, a proposal allegedly designed to save money will cost money. And by the way, as we discovered in the study the Postmaster General and his senior management team commissioned and then deep-sixed because they didn't like the results, it's a similar situation with some of the other so-called reforms that apparently would cost $5 billion in lost revenue, more than offsetting the savings. So here we have another example, a proposed, let's assume, let's stipulate, good intention. But the analysis does not hold up. We're going to lose money, and I'm shocked. And that loss of $500 million grows over time because of the aging workforce and the fact that newer, younger folks aren't coming in because of the shrinking of that workforce.
That's the case.
Now, you also said a second problem with this, I'm sure also unintended, is that we're going to have one heck of a penalty on widows and other survivors who currently aren't signed up for Medicare A and B. And the reason there's an $8,000 per person penalty or cost is because they actually have to pay a certain penalty, don't they, under Social Security?
Yes, sir. Let me just make clear. Under current law, if you do not have Part A through the normal post-employment way that you get it, okay, and there's a large number of people in this country, several 100,000, who don't have that, you get to pay the princely premium for signing up for Part A of around $5,000 a year. Now, that I've never heard of anyone paying that. Actually, I have, but there aren't many who would pay that. But the proposal as written says they're going to force it to. Now, actually, hidden in.
So it would be an individual mandate.
Yeah.
My goodness, Mr. Chairman, I can't imagine this subcommittee.
Part B has a penalty of 10% a year for every year you could have signed up after age. Actually, I'll simplify, after age 65. So if, say, you're an 80-year-old widow, you've got 15 years of 10% of your penalty if you sign up for Part B. And again, those, you could change the Social Security Act to get rid of those penalties. You know,
so, given my brief time, Walt, it's going to cost $500 million a year to the Postal Service, hardly saving money, and that grows over time. We're going to penalize widow ladies to the tune of about $8,000 per widow, and there are tens of thousands of them because, again, of the nature of the workforce and the retiree demographics. Now, a third consequence from this proposal, of course, is an FEHBP itself, is it not? It reduces the risk pool rather considerably given the size of the Postal Service.
It'll be a cosmic change. For example, a lot of the
cosmic.
Well, I'll give you a simple example. Two examples. A lot of the HMOs that participate in the FEHBP are in cities where the main part of the federal workforce is postal. Okay? Guess what happens in those cities? HMOs are going to say it's not worth doing business. We used to have 1,000 enrollees. Now we're going to have maybe 0 or maybe a few hundred. So they're going to pull out. So a lot of people who are not postal employees are going to lose that access. I think it's unlikely that any of the postal plans would survive this. It's possible, but almost all the postal plans predominantly enroll either current postal employees or retired postal employees, and they are not going to be allowed to enroll either group.
So other than that, it's a great idea. My time is up, Mr. Chairman, but I just want to cite H.L. Mencken, who once said that for every human problem, there is a solution that is simple, neat, and wrong. The Postmaster General's proposal on health care fits that description.
Thank you. Now recognize the ranking member of the subcommittee, the gentleman from Massachusetts, Mr. Lynch, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Francis, for your willingness to come and help this committee with its work. The idea of insurance usually or generally is that you spread the risk of harm or illness over a wide population so that what happens is the healthy folks, which is the majority of people, subsidize the cost to those of us who get sick. That's how insurance generally works. The way the Postmaster General was describing it today was that we were going to concentrate the risk. In other words, if an individual participant was just by themselves, they would pay less. They would pay less, or a husband and wife would not have to pay a family plan. They would pay less, and it would, by its nature, concentrate more of the risk on the very individuals who might be the sickest. Have you looked at that aspect of the proposal?
Yes, I have, sir. The key factor here is that people pose very different risks at different ages. Okay, so by the way, the OPM actuaries have actually looked at this question because it's many times been proposed that, for example, there be a rate for couples. You know, I counsel thousands of people every year, and and they'll raise their hand and say, we're a married couple, we're 50 years old, we don't have all those kids, why can't we get a rate just for us? And the answer is because that young couple with kids is cheaper than you, and if you were in a separate pool, you would pay more, a lot more. And I give an example in my testimony of how it could be double. The FEHEP pool of 8 million people, the 20-year-olds are paying a lot more than they would if they were in a separate category, okay, to be sure. And it's very interesting how this all plays out. And by the way, back to the Medicare point, 65-year-olds with Medicare Parts A and B, they often complain, why can't we get a lower rate? Because we're cheaper. And they're right, because Medicare is primary, and they cost less than those 64-year-olds. So the FHEP says we're going to spread it across everybody, and we're not going to try to chop it up in pieces. And the Postal proposal not only would reduce the pool from 8 million people to 2 million people, it would, by creating 4 premium paying categories, make a lot of people pay more than they pay today. Others would pay less.
Okay. The other question thank you for that. The other question I had is regarding the Affordable Care Act. Under the Affordable Care Act, in 2018, one of the key funding provisions for the Affordable Care Act is that in 2018, if you have an expensive health care plan, then in 2018, you're going to be hit with a 20% tax on the value of your health care plan. Not how much you use, but the value of your health care plan. Now, just for the record, I voted against the Affordable Care Act. And that was one of the key reasons why, because we never used to tax health care because we wanted people to have it. It was kind of like taxing food. We never taxed food in this country because you'd starve without it. Well, the way it looks right now with the framework of FEHBP and most likely this postal plan that the Postmaster General has suggested, it would be within that it would be a Cadillac plan based on the costs now and the estimated increases until we reach 2018. And there's a reason it takes into effect and comes into effect in 2018, because the folks that pushed it will all be gone, and they won't have to answer for this. So, have you thought at all about this 20% tax on expensive, high-end health care plans, and what it might mean for this postal plan if it's separated from FEHBP?
I hadn't, Congressman, but you're absolutely right. It's a potential problem of significant proportions. That provision of the law, by the way, in the Affordable Care Act, ties that number to the cost of the Blue Cross plan in the FEHEP. What will happen, I think, and I'm just thinking, on my feet on this, actually the high-value postal plan, the one they say is equal to anything, it isn't. It's actually inferior. It, for example, has lower benefits than Blue Cross Standard option. But nonetheless, it's pretty close in benefits to that.
Yeah.
It's going to disproportionately attract the older and sicker postal employees who will be, they're all going to be in that group by then, pretty much. And yes, that plan will cost more than Blue Cross standard option in that year, I think. That'd be a reasonable projection. And that tax will hit postal employees.
Okay.
Or the Postal Service.
All right. I see I have, well, actually, I've exceeded my time. I appreciate you coming before the committee and helping us with our work. Thank you, Mr. Francis. And I yield it back.
Thank you. Now recognize the gentleman from Illinois, Mr. Davis, for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Francis, do you see any redeeming value in the Postmaster General's self-run plan, or do you see anything about it that you like?
Well, I hope I'm clear. There is one huge redeeming value, sir, and that is the focus on the need to reform the interface between Medicare and the FEHP. And while he wants to make it compulsory, and I would quibble with some other details of it, he innovatively includes Part D in that calculus. I was pleased to see that. I hadn't even myself focused on the Part D side, but the thinking there is good. It's a basis for thinking about the entire FEHP. So I take, and that's the part that's most important to the Postal Service. I find it hard to believe that they really think running their own plan is going to save any money, but regardless, it won't. But fixing the interface between these two programs, they've been going along side by side for 50 years, and no one has ever adjusted either program, Medicare or the FEHP, to take account of the other. It's bizarre. No administration, no OPM director. I'm not criticizing Mr. Berry in particular, or this administration in particular. It's time for the Congress to take a hard look at reform angles. So that's where I see the positive in this.
But you answered the other question that I had relative to cost savings, and it's your position that it would not save any money.
It's my position that it not only would not save money, that it would cost more. Let me say, quite apart from the extra cost of the older and sicker enrollees, Mr. Lynch had stepped out and didn't hear my point about the premium thing. For prescription drug point, which I know is of particular interest to you, sir, they are saying, and if you look at this Hay report, they'll save, I forget the number, but the bulk of their projected savings come from they're going to bargain better for prescription drugs in their 2 million enrollee plan. Well, the Blue Cross carrier with 2 plans today enrolls 5 million people. So the notion that mere size is going to, and that's illusory. I mean, it's preposterous to say that just because they have a plan with 2 million people, they're going to save money. And in fact, I'm frankly skeptical. I think OPM does a superb job in managing the FEHP in terms of keeping the plans honest and frugal, and I have no reason to think the Postal Service has that confidence.
Yeah, I must admit that with a limited pool and with not as many subscribers or beneficiaries or individuals in the pool, it's difficult for me to see how, unless you had a pool that you could select out or cherry pick, I just couldn't see the money saving. And so let me just thank you for coming to share your views with us. I appreciate it. I have no further questions, Mr. Chairman, and I yield back the balance of my time.
Thank you, Mr. Davis. Just real quickly, and I'll go briefly, and then I think Mr. Lynch wants to do also. As I understand it, if the employees of the United States Postal Service had paid for their health care the same amount that the other Federal employees had, then the Postal Service would be showing a $500 million profit?
Yeah, I would, yes, but let me restate it, sir, if I may. Yes, they have been over, if you will, I don't hate to say overpaying, because these were union negotiated rates.
Right.
But they have been paying about 10% a year more than the rest of the Federal Government every year for the last 20 years.
The Postal Service has been paying.
The Postal Service has. And they could have saved multiple hundreds of millions of dollars every year.
If we had just let them pay, if we had let the employees of the Postal Service pay what the Federal employees were paying.
Exactly.
And which begs the question, I guess, is that that's such a sweetheart deal that it's almost killing the goose that's laying the golden egg.
Yes, and it doesn't give one confidence that they know what they're doing. Though I must say, this Postmaster General is a bright light compared to...
I agree with you. I agree with you. I think he's done an outstanding job in recognizing the problems and realizing that something has to be done. He's very innovative. Mr. Francis, I'm grateful to you for your testimony today. I hope that you do get a chance to work with Mr. Donahoe on this, because I think you bring a lot of things to the table. With that, I'll recognize Mr. Lynch.
Mr. Berry, the Director of OPM, has suggested that the 9 million people, Federal employees who are right now in the FEHBP, the Federal Employee Health Benefit Plan, prescription drug program, he has suggested that that 9 million be taken out of that program so that they be allowed to use a competitive process to lower, to pick a plan, pick their own drug benefit plan, and could probably get a better deal, because they're being overcharged right now in the FEHBP, but they're a captive group. What do you think about that proposal?
Congressman, I know it's probably near and dear to your heart, but I'm against it, and let me tell you 2 reasons. One, let's assume it's correct that that somehow OPM could bargain better than Blue Cross. I'm not at all convinced with
well, no, they're suggesting that individuals be given the power.
Oh, I thought they were talking about a single drug contract. But let me just say, assume some money can be saved. The problem is this. You want to have a drug benefit integrated with the hospital and doctor benefit.
Okay.
It's less important that you may be paying $21 for a certain pill instead of $20 or vice versa. That's a lot of money added across a lot of people. But compared to, hey, if this plan is able to make sure you take that pill and stay out of the hospital, that's where the big savings are. So you really want the health plan to be managing all the pieces at once. That's disease management. It's done quite well, I think, by many health plans, but not by all. And that is the wave of the future. That is all the Medicare reforms that this administration is making. Accountable care organizations and so on are all aimed at that same idea. We want people to look at the totality of costs and services that a person gets and minimize costs and maximize their health.
Well, thank you, Mr. Francis. Not the answer I was looking for, but I certainly give you credit for that. Thank you.
Thank you, Mr. Francis, for being here. That concludes our witnesses' testimony today. I appreciate you taking the time for your busy schedule. Thank you for your input, and the committee now stands adjourned.
Thank you, Mr. Chairman. Thank you. Nice job. All right. Thank you.
How your Bo Sox going to be this year?